This conference will now be recorded.
Okay, so let's go ahead and get started. So today we're going to be talking about um, the National Association for Direct Service Professionals has a code of ethics. And I have the 2016 one up there. I believe they've done some recent modifications. I wasn't able to find those, so didn't make those available. But I strongly encourage you, if you're at all interested, you can go to their website, NADSP, and you can get information. You can sign up. They have regular classes. Some of them they charge for, others are free, but they're an excellent source of information about the field of intellectual and developmental disabilities as it relates to the persons who are providing the services. National organization, they have an accreditation uh, ability. You can, if you want to sign up your home or your organization to become a member, and then Valerie just put their address on the chat. You can do so. Excellent source of information and provide you good support if you want to join in membership. So that's what's going to be today's topic. Starting off, I mentioned it briefly, but if you want continuing education credit for today, and we will be giving 1 unit, 1 hour of credit for today's presentation. And that 1 hour of credit is good for both the Kern Regional Center and also for community care licensing. So if you want that certificate for the 1 hour of credit, please, you need to follow the following. And that is, you have to attend the whole 1 hour training class. You must identify yourself at the beginning of the presentation on the screen or in the chat. So most of you I see are on here, but just to make sure, if there are more than one of you, so there's a group of you sitting there watching me, and the slides that I'm going to be presenting, make sure that we know who everyone is so that we can make sure that we can give credit to everyone. Um, and then within the next month, you need to send to Irene at Bakersfield ARC, and her address is there on the screen, a 3 bullet points of what you learned today. I don't think we need extensive documentation. I don't write paragraph after paragraph. Just 3 points that you found helpful from today's presentation, and that helps us to know that you were on the whole time and that you also got something out of it. And interesting enough, writing things down helps the memory retain those important facts that you learned. So it has multiple benefits, but it also helps us to know who's been on the training and what you learned today. And then finally, we ask that if you do want credit, that you submit your credit request, your 3 items to Irene within the next month, within 30 days. It just makes the ability to keep track of everything so much easier if we get it done timely. So again, that's if you want continuing education, that's how we go about doing that. The Bakersfield ARC, as part of this grant, has a contract with a company called Relias. Relias is a national organization that does trainings in many, many areas. They do trainings in a number of social service areas. They do training for industry, a number of different facets of training, very professional trainings. Bakersfield ARC contracted with them for 31 particular training applications as they relate to intellectual and developmental disabilities. These are online and they're set up such that you can take them at your own pace. So if instead of having to do it on Wednesday mornings like this class is, which might not be convenient for you, you could do it at a different time, including it when you get home in the evening after the kids go to bed, on weekends, whatever works for you. And you can get in there, take part of the course, close it down, come back the following day or a couple days later and finish up the class then. Take the exam. If you satisfactorily pass the exam, then you'd be eligible for continuing education credits, again, which would meet the requirements for both Kern Regional Center and for community care licensing. Unfortunately, due to changes in the grant, the grant for Bakersfield ARC will be continuing into uh, next year, but the current phase of the grant is expiring on September 30th of this year, 2025. And the current phase is where the Relias training is funded. So this will end on September of this year. So if you're interested in this, you need to get a hold of Valerie or Irene as quickly as possible to get a password so that you can get into this training and take the training. But you only really have a little over a month left on this training. So if it's something that you'd be interested in for you or could be for your staff, go ahead and get a hold of Valerie or Irene at Bakersfield ARC, and they can set you up, give you an initial password. You go in, you then reset that password, and you can go ahead and use it. But we're probably going to be shutting it down about a week before the end of September. So again, Valerie at Bakersfield ARC, she just put up her address in the chat. So go ahead and contact her if you're interested in this class. The Bakersfield ARC, as part of this grant, also has is coming up on September 15th through the 19th, a training with the Council on Quality Leadership, which is another excellent organization, and that's called the PALM training. And if you take this class, you'd be certified in how to use the PALM tool, which is an accredited based and empirically based tool for working with individuals with developmental disabilities. Unfortunately, as of the last day or two, the class has filled, but it is a 5-day class. So if you were to want to get involved, it's a pretty good commitment for you or the staff member that you choose to do it. And as such, we may have, if history is any indicator, 1 or 2 cancellations between now and the time that we're going to be doing this course. So if you are potentially interested in the personal outcomes measure training, which is a person-centered discovery tool, give Valerie a call at Bakersfield ARC, 661-834-2272, or at her email address that's on the chat, and let her know that you would be interested as a potential waiting list individual. And that again is the week of September 15th through the 19th. And it's an excellent training. Valerie's been through it, and a couple other of the Bakersfield ARC staff have taken it and have just said that it is a very strong tool to use in working with the population that we serve. Another training that is up and coming next week, as a matter of fact, is Positive Purposes, who is another grant holder who also got a grant to provide these services under home and community-based waiver, is doing a series on vocational services, because part of the home and community-based waiver says that persons should have the ability to work in the community if that's their choice. And so this is a training on how to go about assisting people with vocational skill development, how to do job development, how to work with employers, how to work with the individual themselves. The first part of this training has already taken place, but the second part would be on August 19th and 20th. In the mornings, it's for day programs. In the afternoon, it's for vocational programs. And so it's both days, 3-hour classes. So if you're interested in that and want to sign up, I'll put this up on the screen for a minute. You can go ahead and photograph that QR code that's up in the upper right-hand corner, or you can contact Positive Purposes here in town, and they can get you set up for the training on Tuesday and Wednesday of next week. The next webinar that we will be doing as part of this series will be the following Wednesday. And so there's a lot of training coming up and a lot of opportunities for those of you who want to get both CEU credits and also to learn more about how to be, better at what you do. Now, as I mentioned earlier, the National Association for Direct Support Professionals has a series of ethical standards. Now, interesting enough, that organization is trying to professionalize the whole occupation of being a direct support professional. And that's part of the terminology that they use. They're working with the federal government to create a job description. They're doing some other important work. They're lobbying in a number of states to make things better for people who work in this field in terms of employment related issues, salaries, benefits, just state standards on how these services go about being provided. So that's what we're going to do today. We're going to talk about what their standards are and what they mean. Okay, so when you see at the top of each slide, the area in bold, that is the NADSP standard. Then below that is sort of an explanation that we're going to be talking about. At any time during this presentation, if you have a question about any of this or would like to make a comment, please open up your mic and just join in. We'd love to. I tend to talk quickly and go through these slides. So a lot of times people don't feel like they can get into the conversation, but please do. I'd love it. Okay, so the first one is recognize that each person is capable of directing their own life. Okay, every individual, regardless of disability, has the right to make choices about their life. Think about that. Every day when we get up, from the moment we get up throughout the day, we're making choices. If we go in, we get dressed. We're getting ready for work. What am I going to wear today? What am I going to have for breakfast? Am I going to bring my lunch? Am I going to go out for lunch when I get to the office? So we're all making choices all the time. But for some of the people that we serve, those choices are made for them. If they lived in a residential care facility, the facilities made the choices about what is breakfast. It packs them their lunch, sends them off the program. The program then has a day planned, so they're not really able to be making a lot of the choices. And the home and community-based waiver says, no, wait a minute. We should be sitting down with people and asking them, what do they want in their lives? We would feel very disenfranchised if somebody was making all of our choices. Ethical practice involves supporting autonomy, decision making, letting people make decisions, providing information in accessible ways. Okay, so these are your choices. Uh, Providing information, okay, and respecting people's decisions. Sometimes we're we don't particularly think that that person's making the right decision, and sharing with them that their decision may not be the right decision, but ultimately letting people make choices. I mean, we do at times, if it's a health and safety issue, they may be putting themselves in jeopardy. Yes, we do need to step in and to do what we need to do. We are, in many cases, licensed or working, or vendored, and there are certain requirements about maintaining people's health and safety. But aside from those issues, uh, people should be making decisions about what goes on in their life, even when they differ from what the staff or the family might be choosing. So, what you might think is best and what somebody else might think is best, uh, it's ultimately their choice. So, years ago, when I was doing a pre-placement for a individual who was going into a residential care facility, the provider said, this is a Baptist home, and everybody who lives in my home uh, attends the Baptist church on Sunday morning. And this individual who was looking at this home as a potential placement said, "But I'm Catholic, and and I've always gone to a Catholic service, and I would like to go to a Catholic service." And so that was a challenge. But today, what we would say is that no, this person has a right to their choice, and if this is the choice that they wish to make based off their heritage and their culture and their background, we need to respect that and need to see about how we can go about implementing that. Even if the provider is going to this church, how do we make arrangements for the individual to go to the church that they choose? Um, Honor those who cannot speak for the by seeking other ways to understand them. So, if you have an individual that you're serving who is nonverbal or has limited verbal skills, how do we go about making sure that their needs, hopes, wants, dreams are also adhered to? It's much easier if you have somebody who is fairly verbal and can express their wants and desires, but that's not all the people that we serve. And so, if you're serving someone who has communication challenges, what do we do to work with that individual? So, communication is not limited to spoken language. So, right now, I'm speaking to you and you're listening to me. So, we've got the spoken language thing, both expressive. I'm expressing myself. Receptive. You're listening to me. So those are both languages. But providers must learn to use alternative communication methods, including gestures. Sometimes people point or grunt or make other facial expression that shows whether they like something or they don't like something. Some individuals have been trained in American Sign Language or just sort of rudimentary signs that they use to express themselves. Assisted technology. Some individuals have, let's say, maybe a communication system, a board that they use to work with. We have somebody who works on this project as one of the staff who his cerebral palsy or her cerebral palsy, excuse me, is such that it requires that they use a little dot on their forehead that they point at the screen, and they can actually use the keyboard by using that dot and moving their head because they're not able to use their hands to manipulate the keyboard. So it's an alternative way of communicating and doing the work that's necessary. So we want to encourage that and to try to find ways of doing that using technology. Also, behavioral cues. Sometimes people let you know beforehand, what is going to, what they're thinking or what they're doing, or, if they're sitting in a chair and not wanting you've asked them to do something and they don't they're not getting out of that chair. They're communicating. They're letting you know that they're not interested necessarily in what you're asking, or that they prefer, their preferences to continue to do what they're doing. So um, we want to understand and honor the preferences and needs of our nonverbal individuals. The next standard is recognizing that the unique culture, social networks, circumstances, personality, preference, needs, and gifts of each person I support must be the primary guide for the selection, structure, and use of the supports for that person. Now, that's a mouthful. But if you break that down, we all come from a culture. And some of us are first or second generation immigrants and have the background that we or our parents grew up in. So if people are coming from, let's say, a Latin American country, some of the values and cultures and supports that they learned when they were younger come with them. Some people are native to this country, and this is their primary culture, is the culture that we is a dominant culture in our society. Um, Social networks. We all have come from different groups of folks. Some people have very involved families or friends or communities. Maybe they belong. Again, I mentioned earlier. Faith, so maybe they belong to a church group and they can continue to be active in that, and that's part of their network. And so we want to be respectful of where people are socially. Uh, and so when I say social networks, that's not necessarily the internet. It's just people's who are part of their lives. Um, Personalities. We all have different personalities. I'm kind of a little bit on the hyper side, speak fast, sort of intellectual. Um, yeah, someone else might be more shy, introverted, maybe more emotional, less rational. All kinds of different um, personalities out there, and we want to sort of get to know and understand that individuals, who they are and what makes them tick, and then and respect that. Needs and gifts. Now, historically, we have focused mainly on people's needs and sort of done that in a model that looks at that as a deficit. The quotes, what's wrong with this person? What do we need to fix? What do we need to make better? How is our programming going to, you know, teach a skill or alleviate a problem? Years ago, when I first started in this field, it was before we had the IPP, the individual program plan. And back then it was called the problem oriented record. And what we would do is we talk about what the person's problem is. Client has nothing to do during the day. Solution: put them in a day program, or ABC day program. So that's one thing. We want to look at what their needs are and where they're, but we want to do that in a way that really looks at positively. What are their gifts? What can they do well? What are their strengths? And we want to try to work towards those. Recently, I was looking at a report on an individual, and it was looking at their cognitive skills. It was basically kind of like an IQ type test. And it said that this person's strongest skills tended to be in the area of language, both speaking and understanding language. So, what the reports was suggesting is that we use that skill to teach other skills. So, if we know that they're good in this area, use that area that their strength is to teach other things. So if, let's say, for example, we wanted to teach some basic math skills, maybe talking through a problem. If John has four apples and wants to give two of them away, how many apples would he have? So we do it as a story, because if for that individual their strength is language and understanding language, and where if you just wrote down on a piece of paper 4 minus 2, it wouldn't really work for that individual. So understanding how an individual learns and what their strengths are really makes a big difference. And that should be the primary guide and structure that we use to support the person. So when we're looking at, okay, so how do we build skills and how do we go ahead and support you? It's respecting who you are, what your culture is, what your network of people, family, friends, other things in your life, and who you are, who you are, your personality. So all those areas really are important to look at when you're getting to know that individual and then providing ongoing services and supports for them. Um, Next ethical standard is advocating with the person I support and others when the demands of the system override the needs of those I support, or when individual preference, needs, and gifts are neglected for any reason. Now, the first one we've all sort of run into. We work in a system that has lots of rules and regulations. I joke around sometimes, and for a number of years, the state Department of Developmental Disabilities used to print the Lanterman Act every other year. They would print out and they would send it out. Um, and now it's all online. And if you ever are interested in finding the Lanterman Act or Title 17, if you go to the DDS website, which is dds.ca.gov, so DDS California CA.gov, it will give you the information on how to find the Lanterman Act. You just click on it and up it comes. So they don't print it anymore. But when they used to print the book, I watched it over the years and it went from this to this, over time. It just kept getting bigger and bigger, and there were more and more rules and regulations. And we want to make sure that we don't create a situation where we're dealing with people before paper. I mean that's what we want to create. I got confused there for a second. We don't want paper before people. This is what we don't want. So we want to think about the person before the rules and regulations. But we do need to be cognizant of the rules and the regulations. when I worked at the regional center, sometimes there was a regulation that specifically said that when we were looking at uh, funding for a service for an individual, we had to look to see if that was available through some other resource before we did regional center funding. So sometimes that term is referred to as generic resource. So that means a resource that's there for the general public. So if that person has, let's say, for example, medical insurance or Medi-Cal or Medicare, we'd have to look to that before we looked to providing regional center dollars. But sometimes, what I found when I was working as, a administrator at the regional centers, I'd look at the particular service and I'd say, well, wait a minute, the service that this public benefit would offer or this insurance company would offer wouldn't really be adequate. And the person needed a, a greater service, and we could appeal it, and yet we couldn't get that additional service. So I would go ahead and advocate for that individual to say, wait a minute, we need to use regional center dollars to provide this service because what was available generically wasn't enough or didn't address the core issue or disability that we were needing to address with this particular individual. So you really need to look at the resources that you're using and how the system works. And sometimes, there's a lot of bureaucracy that we encounter, and working with individuals to try to kind of cut through that or to assist them in how to do that. I scratch my head sometimes because I've been in this system for 40 some years, and I still run into roadblocks sometimes where I run into a system that makes it a challenge for me to get something done. And so figuring out how to do that or advocating for that person or getting them plugged into an advocate. So maybe using the Office of Client Rights Advocacy or Protection and Advocacy or greater legal assistance to assist an individual might be an area that we need to look at. And then we also want to look at, again, the whole idea of individual preferences, needs, or gifts of that individual. So we want to look at, okay, what makes this person an individual? And they obviously have needs or they wouldn't be part of this system. But again, what are their gifts? What are their strengths? What can we build on to really enhance this individual's life? So systems can be rigid and they're also under resourced. And now that with the new federal budget that just passed this last month, the big beautiful bill, many of the resources that we've historically used will be even less available. Medicaid took a $1.1 trillion cut over the next 10 years. So, how do we go ahead and advocate for the people that we serve when the system sometimes doesn't have enough resources to do that? But ethically, providers must speak up when policies and practices harm or overlook individuals. And, that can be a challenge sometimes for you as a provider because if you're speaking up, so you're trying to work with the regional center service coordinator or the coordinator at the program that the resident in your home is going to, and you want to do it in such a way that's respectful and going to lead to some benefit for the individual. You don't want to be in a situation where you're alienating yourself from the service providers that you're working with. Every agency has a whistleblower policy, which says that if somebody makes a complaint or brings something to their attention, that they're supposed to review that in a non-prejudicial manner. You can't hold that against somebody. So if I come to you as a provider and in quotes, complain about something that you're doing or one of your staff or something that I would really like to see different from my individual, or they've come home and they're really upset about the way they feel they've been treated at your program. Um, and I bring that to your attention as an advocate for that individual. That's supposed to be done in a non-prejudicial manner that you're supposed to not. But the reality is, we're all human beings. Sometimes people respond in ways that they feel like they need to become defensive, and so that's the trick. And how do you advocate for people in a way that is going to be of benefit to them and also a benefit to the system as well. So we want to challenge unfair rules, uh, pushes for accommodation, make sure that places that we go or take the individuals that we serve to are accessible, that they can get in and out, that the restrooms are available for their needs, and ensuring that the person's voice is heard in all settings. So we want to make sure that as we go places and as we're using the community more, that if and when that person speaks up, we want to make sure that their needs and wants are taken care of. Valerie, I'm getting a flashing thing that once in a while that says poor connection. Is there a challenge of what's going on?
Nothing on my end. I just shut off your
Okay,
camera.
it's
You should
just
be all right.
okay. It's just hiccuping then. Okay. The next one is develop a respectful relationship with the people I support that is based on mutual trust and maintaining professional boundaries. Um, Trust is built through honesty and respect. Consistency, honesty, and respect. So we want to make sure that when we're working with folks, that we're consistent. We're not doing one thing one day, something different another day. Uh, if things are going on in our own lives, maybe we got up that morning and got into a huge argument with our teenager. And we came into the office and we were really upset. Well, we don't want to then change the way we've historically done things for the clients because of our own issues and not having nothing to do with the people that we serve. Um, Honesty, we want to treat people respectfully and honestly. I found over the years that when I sort of you know I don't know. We what's the old term? A little white lie sort of thing. It never worked. It never turned out well. And early on in my career, sometimes I thought, well, maybe it is. I should sort of just embellish the story a little bit or change it somewhat because I think that would be better. And no, no, don't do that, please. It works so much better if you're just honest and share with people what's really going on. Again, communicating with them in ways that are understandable and are respectful. Uh, but you want to do that, and then again, just respect in general. I mean, we want to be respectful of the people that we serve, just like we would want others to be respectful of us. I yesterday went into a store and the clerk was just, treated me like I was almost like I wasn't even there. And so, I left that store with a very negative feeling about the transaction that I have, and that will impact my decision to potentially go back to that store again. So we want to make sure that when we're interacting with the folks that we're serving, that we're doing it in a way that shows them that we really do care about them and that we cherish what their thoughts and ideas are. Um, Providers must avoid dual relationships, maintaining confidentiality and ensuring the role remains professional. Dual relationships are if I'm doing some sort of business, let's say with that client or maybe with their family, so that somehow can impact how I feel about that individual. I'm a clinical social worker as well, and if I was seeing people professionally, if I was then uh, going to their business to do business as well as seeing them, that could interfere with the relationship I have over here. It can interfere with you over here. So, in the work that we do with our individuals that we serve, that can often be such that are we the professional who provides the service consistent with their individual program plan and person-centered plan, or are we their friend and are we their buddy? And the two aren't necessarily compatible in many instances. So professional boundaries can be, okay, so this is my role as your direct support professional. And that's what I'm here to work with you on. I'm not your best friend. I'm not. It really sort of, we want to encourage people to look at other places to develop those friendships and senses of community. We're there to facilitate. We're not there to necessarily provide that friendship. Boundaries protect both the individual and the provider from exploitation and misunderstanding. So if you get into a personal relationship with somebody and they now feel like you're their best friend, and then something happens, and then they're very upset with you or make an accusation. Well, wait a minute, you may have taken liberties with them or something. You don't want to get into that type of situation. You want to, by maintaining that boundary. Okay, this is my role. This is where how I can, or how I do interact with you, and these are the services that I provide for you. That makes it clear in terms of a respectful relationship. Okay. Okay. Assist the people I support to prevent illness, avoid unnecessarily risks, and understanding their options and possible consequences that relate to their physical health, safety, and emotional well-being. Um, Assist people to prevent illness. Now, most of you probably have been providing services through the pandemic that we had starting in 2020. And there were times that we were doing a great deal of like direct uh, support to individuals on assisting them from preventing illness and doing things to avoid unnecessary risk with the individuals that we serve. Now that the pandemic isn't officially over, but COVID isn't, and the flu isn't, and other diseases aren't, we still want to make sure that we're trying to prevent illness and avoid unnecessary risks. So we want to work with folks on cleanliness, washing hands, doing other things. If someone becomes ill, isolating that person from others, if it's a contagious type situation, and doing what's necessary for preventing illness. The other thing that is really important, and I've stressed this in a lot of my previous webinars, is preventative health care. Now, the federal government and a number of professional organizations has standards specific to when certain health checkups should occur. So for women, when do we start doing women's health care specific to, pap smears and mammograms? For men, prostate exams for both men and women, colorectal examinations, other types of preventative health care, prostate exams for men, other things that based on the age of the individual, based on their family risk, based on their history, etc. So we can prevent illness. Skin cancer is extremely treatable if it is caught early. But many people unfortunately get to the point where they have very serious stage 4 cancers related to skin issues. Same thing with colon and other areas. So we want to make sure that we're avoiding unnecessary risks and preventing illness, understanding their options and the possible consequences related to their physical health. Now, when we go to our physician and he says to us something like, okay, the last 3 visits you've been here, I've noticed that your blood pressure is elevating. And so I'd like to put you on a medication to treat blood pressure. But this medication has potentially the following side effects. And then the doctor explains to you that maybe you might get dry mouth, you might get some dizziness, you might feel lightheaded, especially when standing. And then you can weigh the consequences of whether you want to take this medication, even though you might see some side effects, versus the benefit of reducing your blood pressure. So that's sometimes called informed consent, so that you are informed of both the benefits and the risk, and then you make a consent to go ahead and do that. So we want to make sure for our folks too, when if you're a provider of like residential care and you're taking your individual to a physician, the physician writes a script for a new medication, and he's explaining to you as a provider that these are the benefits and risks. We want that individual to be part of that discussion. And so they understand too what the why the doctor is prescribing this, what it will do for them, what it could be possible complications or side effects for that, and so that they can make decisions about that. Avoiding unnecessary risks. There's a certain amount of risk in life, and there's a terminology we sometimes call it dignity of risk, where what's the benefit, what's the risk of a particular thing. If we're training someone to ride the Get bus, so the benefit is that they can get greater independence. And so Saturday morning, if they want to take the bus out to the marketplace there in the Southwest, or or go to a movie, or go visit a friend, they can independently do that. But then there are also potential risks of using public transportation. The other individuals on the bus, maybe potentially if they don't know the routing system very well, getting lost, other things. So we weigh the benefits versus the risks. We work with the individual. We try to tell them what that is, and we try to avoid risks that don't need to be. So if there are 2 options that are available that the individual could use, and one of them is less risky than the other, we really want to make sure that the individual understands that and can potentially make choices that are safer and better for them. And then emotional well-being. The statistics that have been done on persons with intellectual and developmental disabilities show that behavioral health, mental health challenges are very similar to that of the general population. So when you think about things like anxiety, depression, psychosis, other things, those happen to the individuals with developmental disabilities as well. For a number of years, people in the mental health field really felt in many cases what was going on had to do with maladaptive behavior that the client was exhibiting. But as we've really looked at this over the years and done more research, more understanding, more use of therapies with individuals with developmental disabilities, what we found is that no, many of the same sort of trials and tribulations that you and I have with our mental health at times can be similar to the folks that we serve. So, you may have an individual who gets anxious fairly often, gets is depressed and sorrowful quite often, and has a hard time getting motivated to get up and want to do things. They get low energy. So we want to try to assist them with that and to get them into resources that can be of benefit to them to assist with that. Okay. Partner with each person and their support network to identify areas of risk and create safeguards specific to those concerns. Okay, so if they have family, friends, if you're a day program and they're involved and they live in a residential facility or residential and they're going to a day, you want to work with all the people in that person's life to make sure that we've identified areas of risk that we can safeguard and to try to make things better for that individual. Now, the a law that the Lanterman Act talks about how, like, for example, regional center is supposed to have a committee that specifically looks at all the special incident reports, the GREs that come in every month and with some regularity, and to look to see if there are trends, things that can be done differently. When I worked at Bakersfield ARC, we had a monthly committee that did just that, where we would sit down and we would look at all of our internal special incidents and try to figure out if there are things that we could do differently. So, for example, if we found that there was a rug in a particular area and somebody tripped and fell over the corner of the rug, either tacking that down, getting rid of that rug if it wasn't really necessary, doing something different to alleviate that risk so no one else would fall. Or if there was a piece of equipment that someone didn't use correctly in the workshop area, how can we go ahead and come up with some safeguard to prevent that from occurring again? So it's a good idea if you do submit regional center GREs, the special incident reports, that you're reviewing your own reports. So afterwards, sitting down with the staff that were involved with the incident, with other folks, looking at that and seeing if there are things that you could do differently, so that doesn't happen again. All right. Challenging other support team members such as doctors, nurses, therapists, coworkers, and family members to recognize and support the rights to make informed decisions, even when those decisions involve personal risk. So working with all the people in their lives to make sure that they are involving the individual and talking to that person about ethical practices include advocating within the team. So when we're sitting down and we're doing the annual meeting and developing that person-centered IPP, that we must ensure that the professionals respect the individual's rights to choose, even when the choice involves some risk. So, for example, like I said, using the public transportation system. This may require educating others about the dignity of risk and person-centered principles. So we may have to let other people know, wait a minute, this is the person has the right to these choices, and they can make decisions about it. You and I can make choices that aren't necessarily the risk-free. If I decide one evening at 10 o'clock at night that I want to go out and take a walk around the neighborhood, and my neighborhood isn't the safest part of town, I can do that. There's a certain risk that's associated with doing that. And if I know what those risks are and still decide to do that, then I can take on that risk. We just need to make sure that people understand really what the risks are, and if there's an alternative that can be done that is less risky, to make sure that that person understands that there are those less risky alternatives. Okay, it is 10:57. Let's take a look here. I have 2 slides left, so I'll just try to go through those really quickly. Be vigilant in identifying and reporting any situation in which people I support are at risk of abuse or neglect or exploitation or harm. So if you see the old saying, if you see something, say something. Providers are mandated reporters. You do have to report to both Adult Protective Services, and if you're a licensed facility, the licensing and regional center, and must be alert to signs of mistreatment. Ethical practices involve taking swift and appropriate actions to protect individuals, documenting concerns, and following legal and organization protocols. So if you have an organization and you have a protocol within your organization, you make sure you follow that. You also make sure you follow the laws related to mandatory reporting of elderly and disabled individual abuse reporting requirements, and then also special incidents consistent with regional center and community care licensing if you're a licensed facility. And then the final slide for today, address challenging behaviors proactively and respectfully. If aversion or deprivation interventions techniques are included in an appropriate and approved support plan, I've worked diligently to find alternatives and and eliminate these techniques from the person's plan. Okay, home and community-based waiver basically says we don't use aversives. We don't use techniques that are harmful. We don't use timeout. We don't, do things that are negative with people. We try to find positive ways of intervening. An old saying that I often use is you can't be doing something negative and something positive at the same time. So why don't we try to focus on trying to get the person to do something that's positive rather than a behavior that's challenging to them or to others. So trying to figure out ways that we can work with people to benefit that individual is really helpful. So again, it's 10:59. Any questions? Open your mic and ask, or anything you want to comments you want to make on these standards today. And again, make sure you did let us know you were on, and send in your 3 bullet points to Irene over the next month to get your credit. Comments, questions, concerns? Okay, with that, I'm going to, again, one last time, if any of you haven't got it, your name or in, please do so at the moment, because I'm going to shut it down in 10 seconds here. So, all right, I hope you all have a good day. And if you're planning on coming next week on Tuesday and Wednesday, look forward to seeing you then. And have a good rest of the week. Bye now.
Hey, Jeff, I'm not